clinically, when I treat patients with pain, and if, for example, if we palpate or give palpation to an active trigger point in the infraspinatus muscle, the patients can feel pain in the low back. And if you examine the low back, you can also find a trigger point just there. It's So that means that there may be some kind of connections between trigger points. In order to prove this, my research is clinically oriented, and I want to find some mechanisms or solutions to the clinical phenomenon that I see. In this study, we used two needles. One needle in the infraspinatus muscle. We gave glutamate injection through the injection needle, EMG needle, and the other needle is in the arm muscle. It's carpi radius brevis muscle, and the two needles can register intramuscular EMG, and also there's two sets of surface EMG electrodes. And the glutamate injection was injected into a trigger point in this infraspinatus muscle, controlled by the isotonic saline injection. And this study was published in Clinical Journal of Pain 2 months ago, probably. And we could see that glutamate injection, glutamate is an analgesic substances to increase the nociceptive activity at myofascial trigger point. We could see injection into a trigger point in the infraspinatus muscle increases the spontaneous EMG activity at the arm muscle. We could see the increased EMG activity from the intramuscular EMG recordings, whereas there's no significant change in surface EMG activity. That means the intramuscular registered spontaneous electrical activity is more sensitive than surface EMG in these circumstances. And isotonic saline injection does not increase SE at another trigger point.